Well, good afternoon and welcome everyone to our discussion series, Human Flourishing 2030. My name is Kimara Ellefson and I am pleased to serve as the National Director for Partnerships at the Kern National Network for Caring and Character in Medicine, or the KNN. This afternoon marks our second session in our discussion series, Human Flourishing 2030. Throughout this series, we're examining what it will take over the next decade to create a healthier future, one where practitioners and health professional learners and patients are all flourishing. Here at the KNN, flourishing is the North Star for all that we do. The KNN is dedicated to advancing caring and character in medicine with the ultimate goal of promoting human flourishing. We pursue this aim in collaboration with 7 founding member schools and stakeholders across the healthcare ecosystem. At the KNN, we believe that when clinical learning environments, care settings, and healthcare organizations support well-being and purpose for learners and professionals, that it's then that practitioners, patients, and families can truly thrive. The KNN's integrated framework shapes these efforts and shows our hypothesis on how caring, character, and practical wisdom are interwoven in cultivating human flourishing. Like a tree's trunk and branches support growth and thriving leaves, these interconnected concepts support human flourishing and advance the profession of medicine. Many individuals that we have spoken with, many of you included, have found the tree an apt metaphor for flourishing. Flourishing is something that grows and develops and is constantly changing. It helps symbolize that flourishing is not simply a steady state, that like leaves change color with the seasons or even fall to the ground, flourishing indeed ebbs and flows over time and over lifetimes. The integrated framework diagram also shows how caring, character, practical wisdom, and flourishing operate not only within us as individuals, but also at a broader level, like we're going to be discussing today, at the organizational and system levels. In the previous session, we explored ways to elevate human flourishing within diverse communities. Ultimately, we had an engaging conversation around how human-centered design, curricula, and engagement approaches can create systemic change that promotes community, wellness, and thriving. Although encouraging flourishing at the community level is important, it does require that organizations in the community also are building cultures of flourishing within their own walls. As the saying goes, you can only give what you already have. And so today's panel will explore ways to create a stronger organizational culture, one that cares for the caregiver, celebrates and embraces diverse perspectives, and helps those within the organization flourish. To address this very important issue, we have an exceptional group of panelists. Our moderator this afternoon is Melinda Buntin, who comes to us from Vanderbilt University School of Medicine. There she focuses on healthcare delivery and costs and co-leads the Vanderbilt Policies for Action Research Hub. Sister Teresa George, she formerly served as President and Chief Operating Officer at Dell Children's Medical Center and currently serves as treasurer for the Daughters of Charity province of St. Louis. Bob Brown is a neurologist by training and is the director of the Mayo Clinic program in professionalism and values, as well as the Mayo Clinic Values Council, which helps perpetuate Mayo values at every location. And finally, Sister Tierney Trueman, who's currently serving as the coordinator for the Mayo Clinic Values Council. She also volunteers in pastoral ministry and as a translator. And once again, we are incredibly honored, and I am so excited for all of you to experience this panel of extraordinary people this afternoon. Now, to ensure that you have the best viewing experience possible, please make sure that you have selected speaker view as we've shown you on the slides here. Also, Our panelists will be available after the main program, but there's no need to wait on submitting your questions. As they're talking, if a question arises, please place them directly in the Q&A portion of the chat, and we will get them queued up for the end of the session. Lastly, before we open the program to our panelists and hear about their organizational experiences, I would like us all to just pause for a moment and think about your own experiences. I'd like to invite you to consider the following question and then to enter your response in the chat. In a word or two, what would a culture of flourishing look like in your organization? And I think Sarah has put the question in the chat for us. In a word or two, what would a culture of flourishing look like in your organization? Kindness, joyful collaboration, respectful, calm, now they're coming. Support, peace and tranquility, heaven, vibrant, empowerment, integrity and health, nurturing, diversity, racial harmony, collaboration, joy and humility, connected, collaboration, autonomy, discovery. Can you imagine, as these words are coming in front of you, if you've got the chat open, imagine if those were all the words that you could use to describe the organization and the culture of which you are a part. That is what we want to talk about this morning, or this afternoon, excuse me. And that is what we are hoping to be able to advance throughout medicine and throughout the health ecosystem. So please do keep those coming. We'll gather these words and think about sharing these back out to all of you in a word cloud or something like that, that would give us an opportunity to continue to reflect on what a flourishing culture and organization could look like. So thank you so much for continuing to share that. So I don't want to take any more time away from our panelists. And so I'd like to welcome our moderator, Melinda Buntin. Melinda, I'm going to turn things over to you.
Thank you so much, Kimara. It is wonderful to be here with all of you on this Zoom, and in particular with this amazing panel. It is a privilege to get to ask them a few questions. And I want to start by inviting them to introduce themselves, tell us a little bit about their story, if you will, and how it relates to creating a culture of flourishing. And I'd like to start with Sister Teresa.
Darn. I'm Sister Teresa George, and as you noted in the introduction, I had spent some time as administrator, chief operating officer of Dell Children's Medical Center in Austin. So working in healthcare, much of my community life as a daughter of charity. Now I'm serving as a treasurer for our province. And part of my responsibility here is to oversee the campuses where our senior sisters are living. We have 4 campuses where we have over 150 sisters in retirement. And when I think about creating an environment of flourishing, it's very important for me to think about that in relation to our sisters that I would say are they think of themselves kind of at the end of a long life of ministry and service. And it is very hard to let go of giving and serving. And so finding a way that they can feel fulfilled, that they can continue to be who they felt called to be in the very beginning, which was a servant. That's creating opportunity for them to be their true selves and to function at their highest level that they can. So it's a struggle because a lot of times they don't necessarily see limitations. They see opportunity, but they don't see the limitations. And it's helping them to retain as much of their independence as they can and still be able to accept the help and support they need to thrive, to feel joy in what they do. I spent the years at Dell Children working in a pediatric care environment. So, flipping from one end of the spectrum to the other. And I think we were trying to do the same thing. I was supporting the caregivers there who really were trying to enable our kids there to reach their fullest potential, to live their fullest potential, because I think that is how people thrive.
Thank you. Sister Tierney.
Yes, thank you. I'm an educator by profession. Science is my field, and my work has been in the nonprofit sector. I'm a Rochester Franciscan. I taught for 9 years of science in a parish school here in Rochester, junior high, my very favorite age group, let me tell you. And then we have a serious ministry in Bogota, Colombia, 2 schools, drop-in clinic, lots of peace and justice. So I served there for 31 years, lived through significant social upheaval, the bombings, the fight between the government, the paramilitary, and the guerrilla. Served as a teacher and administrator, mission coordinator. One of our schools was for women, and that the Santa Francisca Romana, we called them the Pachas. And when you talk about values, the profile of a Pacha was a woman of faith. We're a Catholic organization, and with a servant leadership and service for the poor. And that was the profile we tried to encourage our young people to grow into and form in themselves. And then we had a school for the very economic poor, the drop-in center that served people who did not have access to education or healthcare. And out of that, one of the pieces I do believe is that I think one of the greatest forms of poverty on our planet is that child born on this planet, gifted, but never with an opportunity to a quality education and formation and become the child of God, respected with dignity. I think that's one of the greatest forms of poverty. Obviously, we own that. So my whole background is Francis. And of course, Francis lived at the time of the breakdown of the feudal system, a very rigid class system, and said, look, there's another way for people to live together in harmony. And part of that harmony, he called everyone brother and sister of all of creation. He saw the relationships as the greatest way we live together as human beings on the earth. And for the last almost 10 years, I've had the privilege of serving as the coordinator for the Mayo Clinic Values Council. And what I've learned in the history, when that famous tornado went through here in 1883, Mother Alfred, our foundress, and Dr. W.W. Mayo, 2 very strong, feisty people, came together. She helped care for the injured, offered to the sisters, would raise the money, build the hospital. If he and sons designed it and staffed it. And what I learned about him in a more recent biography by Judith Hartzell, she's quoted in the Ken Burns film, he studied his chemistry under John Dalton. Dalton was a Quaker, and Judith calls him a mentor to him. And what are some of the Quaker beliefs? There's a piece of God in every one of us that gives us our human dignity. Therefore, we do nothing to harm or threaten another person. Women are equal to men. A partnership between Mother Alfred and Dr. Mayo that is the foundation of who we are as Mayo Clinic today. And you best serve your brethren by helping them become fully functional, all they're called to be. And I believe one of the most distinguishing qualities, characteristics of Mayo is how we understand and live the value of teamwork. So it's that harmony that comes through valuing the dignity of every person, living in mutually enriching relationships, respecting how difference enriches us, not divides us.
Thank you. And Bob, tell us a little of your story.
Well, good day, everyone. I'm delighted to be here with you today. And thanks again for the invitation to be here with you and to join my colleagues who are panelists today. And as was mentioned, I'm a neurologist here in Rochester, at Mayo Clinic in Rochester. I came to Rochester in 1983, so I've been here 39 years. I came here as a medical student thinking I'd be here 4 years and then would move on to wherever to do a residency and fellowship. But I ended up, in retrospect, I ended up really relating to an organization that was very values driven and values aligned. We'll talk more about that today. I know that's the core element of our discussion, but I ended up staying for my neurology residency and stroke fellowship. And then I've been on staff for about 30 years as a neurologist, and I have a clinical practice in neurology. I am involved in the education program and working with the students and residents and fellows, and have a research interest in stroke and cerebrovascular disease as well. But I have the honor to serve as the director of the Mayo Program in Professionalism and Values and the Mayo Clinic Values Council. And our charge is to perpetuate our values across all of Mayo Clinic and to never forget the Franciscan legacy of Mayo Clinic. And some of you may have been thinking to yourself, now, why is it that Sister Tierney is the coordinator of the Values Council? We're oftentimes asked that. How does this relate to the Franciscan legacy of Mayo? And Sister Tierney has stated it so well. It dates to this remarkable partnership between Mayo physicians and other staff members and the Franciscan sisters dating back to the 1880s. And it really helped to inform the values, our core values and primary value as we know them today, because they truly are the vision and intent of our founders. And we can get more into that. But when you relate then our values and culture to the concept of flourishing, we really consider that the values and action at Mayo Clinic relate to virtually all initiatives that impact on our staff, whether it be equity, diversity, and inclusion, or the impact on our patient through our Office of Patient Services, or through our Mayo model of care. And I could go on, but it all relates to how we put our values into action, how we hold each other accountable to these values that we'll talk about in just a moment, and how our leadership can make decisions focused on these values so that we collectively feel that we're working at an organization and that we're able to serve our patients at an organization that brings these values to the forefront. And I want to say at the outset, it's not to suggest we're perfect, because we're not. And I think that's part of being at a flourishing organization, is to hold each other accountable when we're not being as values aligned or as values driven, whether it be holding each other accountable individually or as an institution. And so I again welcome the opportunity to be here with you today, and for all of the attendees, participants who have joined us. Look forward to your questions and to the discussion. So thanks again, everyone.
Great, thank you. And I guess I should take the opportunity to say a little bit about where I am, although I'm very much more interested in what the panelists have to say. But here at Vanderbilt, we have a relatively new chancellor of our university who had his investiture ceremony a few weeks ago. And he came to the institution during the pandemic, so this celebration was postponed for obvious reasons, and had the chance to really look at the organization and try to grasp at what was special about Vanderbilt and where it is. And he came up with a term that he used during his investiture, which was that he felt we had a spirit of radical collegiality. And I don't think most of us on the faculty had thought about ourselves as radically collegial, but I think he captured some of what makes Vanderbilt a special place and sets it apart from some other academic medical centers when he said that. So, and I would be hard pressed to say that we have a story of why we are that way that's as compelling as the Mayo story. So I might actually ask Sister Teresa, I mean, in the organizations that you've been with, do you feel that it's an important part of those organizations' journey to have a story of where they are, then that enhances this culture of flourishing?
You're asking me?
Mm-hmm. Yeah.
I absolutely think understanding the story and the background, where you come from, mm-hmm. is important for understanding the values that drive you. And that doesn't mean you stay there. Mm-hmm. I think understanding that as a foundation helps project you forward, propels you forward in continuing the mission. And you mentioned that I had been at Dell Children's Medical right. Center in Austin, which was a part of a larger health system called the Seton Healthcare System, which is a part of Ascension Health, which is a very large health system. And our congregation was one of the founding congregations of that system. So we tell the story of how that system came about, mm-hmm. who our founders are, and we've even taken groups of people to Paris to see where St. Vincent de Paul and St. Louise de Marillac walked the streets there and served the poor, because that's the foundation on which we minister, and the values we operate out of comes out of their spirit. Mm-hmm. And it's important to pass that along, but it has to continue to evolve in order to respond to today's environment. And again, I think if we would still be wearing the, that big cornet with pointy hats, and we would be treating people with some very strange concoctions if we stayed back in the 17th century. We have to bring that to today and understand what new ways we can serve people, and responding to new forms of poverty. And it looks very different. Poverty can take the form. You can have, I had often said that you could have very wealthy people, but when their child is sick or when they are sick, they are poor and they need us. And so you have to understand where, the situation, and adapt your values and your culture to meet the needs of the people you're trying to serve. But if you don't know the story, you can't carry that forward. I don't know, either of my colleagues would feel the same way. If you can't tell that story, you're going to lose the essence of who you are.
In piggybacking on what Sister Teresa said, I think it is such a good point. Melinda, you asked a very interesting question. And you never want to have your history lead you to continue to look back, because you have to be a forward-looking organization. But just like you said, Sister Teresa, how an organization can make use of a history, whether it be 150 years in duration, as it is at Mayo, or several years, a few years in duration, as it might be at some other organizations, is use that history to help to indicate how did that inform the institution we became to be and who we are today, but also who then do we aspire to be 10 years from now, 30 years from now, 50 years from now. And that's how we make use of it here at Mayo Clinic, is we look back because we have the pride and interest in that history, but we really tell ourselves, okay, that is what informed the institution that we are today, but we owe it to that legacy and to our patients to strive to be even better 10 years from now, 30 years from now, 50 years from now. So it is useful, but I sometimes we're asked, well, we don't have 150 years of history. We have 10 years of history. That is in organizations that we get to visit with. And we talk about, we kind of turn it around and say, but how has that 10 years or 20 years really helped you to form the evolving culture and the value set that you take great pride in at your site? And how does that guide you in deciding how your strategic plan is going to get you to where you want to be 30 years from now? So that history and heritage can be helpful to guide you just about no matter what the duration, but take pride in it, celebrate it, and then use that as an accelerant to achieve change in the future.
I'm so glad you said that, because I feel like one of the questions people might have on hearing the Mayo story is, how do we do this within a short period of time? But Sister Tierney, you look like you were about to say something.
Yeah, one of the questions we ask when we do values reviews, we look around the screen. You're a good group doing good things and you know it. What's that 10% missing to take you from good to great? And we do invite them to a reflection on their values. And the first question we ask when we invite people to introduce themselves, what's the gift you bring to your team? It's affirming, I think, first of all, that we are persons who are gifted. Every one of us is unique, brings special gifts to whatever team I'm a part of, whether it's general services or neurosurgeons, and to understand the importance, and that we are persons and an institution that are always becoming. The difference between having a to-do list or a to-be list. And the to-be has to flourish if the to-do list is going to continue to grow, and quite a difference.
Quite a difference.
There are a couple questions that are popping up in the chat, which I'm finding very
interesting.
I'm going to interrupt you, Melinda, as we talk about this story, because somebody asked the question, what do you do when the story has to change? And others were, how do you know if an organization is flourishing? If you're not able to retain good people, something is wrong. If you're not able, if the spirit within, and you can tell walking the halls, if the spirit is positive or if it is heavy and negative and there's more complaining. You can tell by quality outcomes and by customer service outcomes whether you are communicating your values through the way that people behave. And if you are not meeting the measures around quality and customer service and retention, you got to look at how you're carrying out your story, and you do need to make some serious changes. How you make those changes, I think, depends on what the issues are. But one of the most important things is to create an opportunity for your people to tell you what's not working. And if they don't feel comfortable bringing forward the issues and concerns, that in itself is a problem. If you're not listening to them. Because if people don't feel valued, don't feel heard, they're either going to leave, so you lose your good people, or they're going to hunker down and just, kind of just keep doing, but barely getting by. So you've got to create opportunities for people to give you feedback. And then you have to be willing to make changes to address the problems. And that's just good leadership. So I don't know if that helps address some of the question that folks are popping up in there, but you can't do it by just thinking everything is working and not following your quality metrics.
Mm-hmm.
Sister Teresa, I completely agree with you. And you circled a lot of your comments around the concept of engagement. Can you get your colleagues engaged in the process? And if things aren't going well, that's okay. Take ownership for it, engage your employees, and have it become something better. And somebody asked, I think, an excellent question regarding what if the story needs to change? Well, that's how you engage your colleagues and set a new narrative for what that next quantum of time is going to look like if the story isn't one that you're proud to share, if you will, up to this point. Another important aspect when it comes to the concept of flourishing is how successful is the organization to truly put the values into action. Because when you look at across the landscape now of whether it be medical centers or other organizations across the US and across the world, all organizations have values now. You look at their website and the values are there. However, what likely differentiates a flourishing organization and its overall successful organization from some other is its ability to take those values that it espouses and put them into action. As individuals, that is, ask a colleague, and we'll perhaps talk about individual values in a little while, but you ask a colleague at your site, if teamwork is one of your values, what does teamwork look like at your site? And have that be able to, a colleague to say, well, this is how I demonstrated teamwork today, or this is how I saw it in action. And so my point is being very intentional about getting the discussion started regarding one's values. That can really be helpful in terms of engagement, but perhaps most importantly, be able to put the values into action so they become far more than words on a website or on a poster on an administrative conference room wall, and really be able to make those values come alive for your staff. That'll lead to engagement. It'll lead to discretionary effort. It'll lead to overall well-being and patients being more satisfied. And of course, the trainees and research programs will advance as well.
I would add another piece to that, Dr. Brown. Besides getting the discussion going, you've got to keep it alive.
Yeah.
And when that doesn't happen, those values, your story may not change, your foundational story, but the values begin to erode, and then you become a different institution.
Yeah.
And one of the things we've discovered, again, in our many values review, we ask the question, do you affirm your colleagues when they're living the values, those values in action? And over, we don't do enough of that. We need to do more of that. And I do believe that. Besides raising what needs to be addressed because it's not working, the importance of affirming, and we encourage, don't just say, hey, that was a great job yesterday with that difficult patient. Name the value, the compassion you showed to that patient that was so difficult, the integrity you brought in the meeting when we were working with a difficult decision. That's ways of how do you keep them alive as part of your daily in and out. Very important.
I should add, Sister Tierney has alluded a couple times to this concept of a values review. Mm-hmm. And this is one of the many resources and opportunities to discuss our values that we try to bring to bear. And Sister, do you just want to tell everyone, what is a values review here at Mayo Clinic? What do we do?
A supervisor, manager invites us to come and do it. We ask them, okay, tell us about your staff. What are their strengths? Where's the growing edge? And then we invite them. It's an hour initial session. Okay, we go through our values and we have strong value statement. And we invite them to pick two that we do a deeper dive. Let's take respect. What are words that say respect? Good communication, clarity of roles. When there's a lack of respect, what's the cost? What are the barriers? So we go through the positive and negative. Then we invite them. We give them a background history too, where our values come from. And then we invite them to form a group goal based on the reflection. What are you willing to commit yourself to be part of that 10% from good to great? And then we come back 6 months later. And instead of asking what are words, what are examples in these past 6 months that you've seen, that you've been a part of or seen, witness, respect. So it's a good, a lot of positive feedback. Right now, it's very timely.
Go ahead, Melinda, and then I was just going to address one of the questions that came up. But you go ahead, Melinda, please.
Well, I was just saying, do you feel that there's a contrast, Sister Teresa, between like the values, the way you think about values in the organizations that you've been part of and the way that you're hearing that Mayo does? It seems like Mayo has a very specific and crystallized view of values. Like, how would you characterize your organization's key values and what do they say about it?
Yeah, I don't know that I would say that they're different, but I will say we don't have in place a deliberate values evaluative process that they just described, which I think is great. I think it should be, we've tried to incorporate it into a specific employee evaluation. You sit down, you talk to an individual employee and you try to assess how that person is carrying it out. But they don't get to give you the same feedback and say, yeah, but Teresa, you're not carrying it out. And I think that looking at it from an organization perspective, yes, you want each individual to carry them out, but you also want it to be a character of the organization. And what you're describing, Tierney, is looking at the character of the organization. Yes. So I like that, and I'd like to take that back. We have our values of our present Daughters of Charity ministry that I am working as a part of right now. One of them is reverence, and that's respect. It goes beyond respect for how you treat one another and how you treat the people that you're trying to serve. And it's really respecting the human dignity of each person and integrity. And I think where I see the greatest contrast sometimes is where people don't do what they say they're going to do, or they profess to do one thing and then but what they evidence is entirely different. I was reflecting as Sister Tierney was talking, one of my experiences when I was in Austin at Del Children's, probably the most significant conversations someone had with me. A physician came in, sat down in my office and said, Teresa, you said you were going to do X, Y, and Z, and you haven't done it. You have not carried out what you said you were going to do. And holding up the mirror to me, while it was hard to hear, was what I needed to hear at the time to call me back to that value of integrity, to be what I said I'm going to be and to live out what I say I'm going to do. And so I think that's one of our values right now as an organization. And when I hear things like, I don't feel like I can speak my truth or bring forward any issue because I fear retaliation. That is one of these, to me, that's the worst thing that can happen, is for people not to feel like they can bring their issue and concern forward. You're not living the values, either reverence for that individual and the contribution they have to make, or the integrity of the organization. So those are things I listen for when I am either evaluating and assessing the effectiveness of what we're doing as an organization or an individual. I don't know if that answers your question.
No, that's really gives me a lot of food for thought. And I want to switch the conversation just a little bit, because we're all talking about what we can do within our organizations, but we're in a world now where in healthcare in general, there's tremendous burnout. People have suffered. What is going on in society as a whole is affecting us perhaps more than what we are able to do within our own walls. I mean, how do you think about that? How do you keep organizational values alive against this sort of onslaught of burnout and societal change?
Well,
I don't know. Yeah, great. Thank you for going first, Bob.
Tierney and Sister Teresa can certainly comment as well. Certainly all of our organizations that are here today, and certainly Mayo Clinic is no exception, burnout is a very real and a very significant concern in medicine. And it was pre-pandemic. It is both during the pandemic, and I'm very much a glass half full person. Now that we're going out of the pandemic, it'll be likely an ongoing issue. And so you asked a great question, Melinda. And what we try to do, both pre-pandemic, during the pandemic, and beyond, is continue to bring the values to the forefront in terms of challenging ourselves and saying, how are these values alive, for example, in our pandemic units, as we were caring for patients, very, very complex patients. The values were at the forefront. And in fact, it was the values that really got our hospital-based staff through some of the toughest times, or some of our other staff who were asked to do very different roles than what they had done before, because we needed them to do so. The pandemic really mandated it. And when we were able to circle back, and for anyone who say, I don't really want to step outside of my comfort zone and do this role, because they could step back and say, no, wait a second, our primary value is the needs of the patient come first. And one of our hallmark core values is teamwork. And I could go on and on. It made it easier for people to reflect on why they were doing things, how they were doing things, how they were relating to each other. And it helped us to survive a really, really tough time. And we're still working through it. Don't get me wrong, burnout is still a really significant concern, but we're hoping by continuing to put our values and our mission at the forefront that it will allow us to move forward and succeed. And my comments likewise really relate to Sister Teresa, something you had alluded to, and several questions in the Q&A or in the chat asked about it as well, which is, how do you involve the values or include the values across the entire life cycle of a staff member at your institution? Meaning, how do you get the discussion started both before they have ever joined you, in the recruitment phase, and in the onboarding phase, and in their early days after they've joined your organization, and throughout then their career at your site? That is one of the ways of bringing your values to life. And here at Mayo, somebody had asked, there were several questions that asked that, how do you make sure that it's a reasonable values alignment? Because we want Mayo to be a good fit for our colleagues who join us, and we want them to be a good fit for Mayo. We want to celebrate the diversity of colleagues who are joining us at Mayo, but we want to make sure Mayo is a good fit. And so we ask quite a few values related questions in the interview process. And for the physician scientist staff, they even take a values alignment test. It's very short, and it's just a series of questions that they answer as a multiple choice. But it really helps to affirm if it seems to be a good fit, and if it comes across that it may not be a good fit, then we're able to talk further in terms of making sure that's the case. But I can't emphasize enough, diversity of thought must be celebrated in a flourishing organization, but there still should be and must be this values alignment, if you will, that goes both ways as well. And it's just something that we work on very hard here. And we do find that if a colleague joins us, and if their personal values don't resonate with one's own institutional values, they're probably not going to be happy there over the long term. They will not flourish, using that term very, very strongly. And so that's an important part of what we try to do.
I want to just comment a question that asked about hiring. Talk about humbling a doctor, a PhD, MD, PhD, who's head of a large laboratory division. We did a values review with that group, and almost all that staff are PhD. I mean, this is one of the most critical labs, if you will, in the work they do. And he said, I hire so that I learn more. And that, I mean, he empowers his staff, the respect coming out of, he's just a walking example of incredible respect for his people. And they're not having troubles with retention. And of course, the laboratories were people that were really understaffed or overworked in terms of the pandemic, because some of their support staff, 40%, the non-clinical had to cut their staff 40% for 4 months. They had to go on furlough. So those departments were just really challenged. But that was that story about how that lab, but the leadership That's another piece. How do you develop leaders, encourage leadership and empowering your people? Certainly that's awfully important.
I think it's one of the hardest things. I'll admit to saying that hiring for fit is one of the hardest things to assure. I mean, you try, as Dr. Brown mentioned, and Tierney, you can ask questions, but when you're in an hour-long interview, even I can fake it through an hour long. I mean, just stick around. I can fake it an hour. And so being able to really question, know how to ask the right questions in the interview process is good. Assessing and evaluating during any probationary period is important. Having really consistent practices around hiring and evaluation, because when people aren't the right fit, the best thing you can do for them, as Dr. Brown mentioned, is help them move to a place where they will be happy,
Where they fit.
Staying there is only going to create a poison in your organization. And they don't need to be unhappy either. But it is very, very hard to evaluate and move people on if you just keep giving them the benefit of the doubt for so long that pretty soon you're fed up and you can't move them along, because HR is going to tell you, you're not ready. You got to do X, Y, and Z before you can move them along.
Yeah,
You've got to be consistent, and you've got to really make that a priority to evaluate people on the kind of performance that you really want from them, and know how you're going to assess performance against values. I don't think we do it as well as I would hope within our organization. And then it's very hard to move someone out of the organization when it's time. And it can be very expensive.
right.
And it's unjust to the people that are a good fit and they can thrive, but then there's this, you're spending more time on the negative than on the positive. Quint Studer years ago said you ought to be spending your time, spending 80% of your time on the performers and affirming the performance that you want, and 20% of your time moving the people out that don't need to be there.
Melinda, several of the questions revolved around as well. How does one actually then, from a learning and development standpoint, the last question, how do you incorporate then the values? How do you train on values? And this is a really complex issue. And one of the former administrative leaders of St. Mary's Hospital here in Rochester, Minnesota, one of the Franciscan sisters who led St. Mary's for several decades, her quote, I think, is a very important one, which is, values are caught, values are not taught. And I think she nailed it. I mean, really, when you get down to it, even though we do talk about the values during the recruitment phase, and we try to set expectations for what our values are all about and want to make sure that their own personal values align with those. And then when they're coming on board, onboarding, we talk a lot about our values. But in fact, I'm the first to realize that they really learn the values by seeing what their colleagues do, values in action. And then several months into it, as they're working with us, to get the discussion started regarding the values, what they're actually seeing. And we have a whole number of strategies within our values group. And these are strategies that really can be used at very large organizations like Mayo. They can be used at small organizations, which is get the discussion started. At your team meetings, take 2 minutes to call out values in action. Put the values up in front of people early and often in any way possible, with your mindset always being, how do our values look when they're in action? And how are those values relevant to that colleague, no matter what their role? And if you can make the values relevant, you're going to lead to an organization where colleagues are going to flourish and be very satisfied and happy with their situation.
Dr. Brown, you mentioned Sister Generals, and another thing she said, the point about leadership, you know, your leaders, that's a huge task. She said, oh, she was the last administrator of a huge hospital, 1,000+ beds. She said, the staff don't work for me. I work for the staff to make their jobs easier so they give the best care to the patient. We all work for the patient. But what an incredible lens out of which to see your role as a leader. The staff don't work for me. I work for the staff.
Right. I think the single most important thing for disseminating values is the leaders giving example.
Mhm, mhm.
If I don't live it, they're not going to live it.
No. Mm-mm.
And if I am not present, they don't see me around, then how are they going to see the values and action in what I do? So I think presence is very important. I think leading by example is absolutely essential, because it doesn't matter what you put on the wall, and it doesn't matter what you say when you stand up in a room to try to teach a value if they see something different. I think that's why integrity for me is so essential. Somebody said, shouldn't that kind of be the guiding force for all of us? Yeah, it should be. You shouldn't even have to make it a value. It should be how we live. When you were talking about, helping people deal with burnout is, I think one of the most important things is for them to see you're in it with them as a leader. And I try not to ask anything of people that I'm not willing to do, which makes me a very bad delegator. Last January, when we had that terrible increase in COVID after Christmas, it finally crept in to one of our to 3 of our senior centers. And we had a number of nurses who had to quit because they had to take care of their parents. And they couldn't be going in and out where COVID was. And so they left, and we were terribly shorthanded. I'm an accountant, but one of the sisters that is on the leadership team with me is a physician assistant. And she and I said, well, let's go. So we went to Albany, New York in January. Yes, it's terrible, but we weren't leaving the building anyway, so it didn't matter. And we functioned as nurse aides and did whatever needed to be done. And that was the most important message that the rest of the staff there saw, was that the sisters were with them. The leaders were in there with them.
Yeah.
And I don't think they had any other turnover after that. And I'm not bragging. I don't know that I couldn't be in all 3 places. I could only be in one, but it said something to them that we were with them in it. And nothing goes as far as the presence and the example that you give as a leader of an organization.
One of the questioners asked, one of our attendees asked a great question in terms of, how do you assess this? How do you assess it over the long term to see how you're doing? And we try to make use of an all-staff survey here at Mayo Clinic intermittently. It's typically every year to 18 months. And there are several questions on that all-staff survey that reflect values. They ask questions regarding our institutional leadership, making decisions consistent with our values. Are you able to work in or do you work in an environment in which you can live out the Mayo Clinic values? And there are several other questions, and we have had those questions consistently. So we're able to consider that over the course of time. And of course, we can break it down by work unit as well and assist those work units that may have some challenges for one reason or another. But I think that it is useful, no matter what one size of the institution, to try to assess that. And we have burnout questions that one of the attendees really did point out nicely. How do questions regarding burnout relate to flourishing? And there's some really indirect connections there. But questions regarding burnout are useful to have in a survey, but likewise, questions related to values, questions related to culture, questions related to engagement. We try to look at those together. And I'll just mention, as a 30-second aside, one of our colleagues did a research project a few years ago, and they looked at a work unit specific values questions, how they were doing on values, culture, engagement. And they assessed how that related to patient satisfaction scores in that particular, across the myriad of hospital units. And there was a very, very strong connection between the two. It was reaffirming that we need to continue to put our values at the forefront and get the discussion started and continue regarding our values, but it's a very real phenomenon.
Great. Well, I promised the three of you that I would cede my moderator role to you and let you do a round robin of questions to each other. And so in our final few minutes of the panel, I wanted to give you the opportunity to do that. And we agreed, Bob, you would start.
Oh, well, very, very good. So Sister Teresa, for all of us, if we were going to do one thing tomorrow to best support a flourishing medical center, an organization, what would I do tomorrow morning at 7 o'clock when I come into the Mayo building?
I would walk around and I would talk to as many people, as many staff people as you could, and even families of patients and patients, and listen. Listen to what people are saying, how they're feeling, what's the spirit of the organization, and what are you hearing that doesn't sound consistent with what you would want to hear, and try to address that. Spend as much time as you can listening to people as close to those you're serving as possible.
Thank you.
It's not always easy because there are a million people that want you that first hour.
Yeah. No, thank you.
Great. All right, your turn, Sister Teresa.
My turn. I want to ask Sister Tierney, one of the things that we're trying to do more of is advance the diversity within our organization, within our leadership, even if it is a pretty homogeneous staff. How do we have them be appreciative of the diversity within our workplace and within those we serve, appreciating it? And it can be racial, it can be gender, it can be religious. How do you do that? Is this something that Mayo is working on among your organization?
Mayo has this wonderful program that they created. They committed $100 million over 10 years to,
Oh my God, I think
yes. Every Friday, they have a program called Everybody In, and I'm going to speak for myself, what that has done, and they film it. So if you have a meeting, you can pick it up.
Talk about why that's important to you.
Okay, I'm going to tell you what surfaced in me, and I've been a teacher all my life, even in this job. I am appalled at my ignorance in terms of my unconscious bias. And what that has helped me to do is bring that to the surface. I have a long way to go, but I've just learned so much about that. And I do believe until we own our white supremacy and the privilege out of which we live, that it's just so embedded in us until we raise those awarenesses. I can do surface things for facing racism or sexism or genderism or anything else. But until I begin to, I'm speaking very personally, until I begin to deal with that aspect of my life, then my words, I think, would be quite empty. You know, like one African-American man said, one of the most hurtful things is when people say, well, what more do you want us to give you? Like, we've got this incredible treasure that's ours, and we'll humbly give you some. I mean, I've learned so much in the little words, the gestures, so that to me is, I think we need to start there to really respect diversity. And then the other question I really work with is, how do I look at you and how you're different from me and realize our differences mutually enrich us? They don't have to divide us.
Thank you. Thank you.
I might only add to that, the Office of Equity, Diversity, Inclusion in Mayo Clinic is one of our key partners when it comes to professionalism and values. And we work very closely with them because this is a extremely high priority for Mayo Clinic, not only at our Mayo Clinic sites across North America and across the world, but in terms of how ending systemic racism in medicine, how can we assist our partners, all of you who are here today, to accomplish that?
Wow, well said. And if I didn't, if it weren't so perfectly appropriate, I would have thought you were trying to get away with Sister Tierney not asking you the last question, Bob. But that was, I love what you said. But here, we're going to give her that last chance, the last word.
Okay. I said at the beginning, before maybe some of you were on, Dr. Brown, he's probably, not probably, you are the most diplomatic person I have ever met in my life. And how you ask questions or give comments to people, just your thank you for asking the question, because that demeanor, that calm, respectful demeanor opens up the possibility for conversation. You don't threaten people, quite the contrary, you welcome it. So what are your keys, or how do you do that, Dr. Brown? How do you keep that very consistent demeanor that I am appreciative I live every day?
Boy, I'm flattered with the comment and the question. And I think for all of you who are on today, you go into medicine or you go into a role for a variety of reasons. One is to have the opportunity to interact and work with patients and colleagues and working together on a team on behalf of the patient. And if you continue to step back and consider what is your opportunity during this limited period of time, if you will, that you're in the field of medicine, it's hard to approach things in any different way. I mean, we are afforded this unique opportunity to care for our patients, to work with our colleagues, working together as a team, and to try to make your institution a better place, if you will, day in and day out, making use of combining your personal values with the institutional values in order to do so. I think that's how we all approach things. And it's that sense. Sister Teresa, you asked, what would you do? Or I asked you, what would you do tomorrow morning at 7 o'clock? When you said you talk to colleagues and your patients and ask questions, Sister Tierney, I think that's what drives me to have that sense of inquiry that you stated, and that I so appreciate the opportunity. It's interacting with people and to try to leave them, our patients, in a better place after they've had their Mayo Clinic experience. And at the end of my time here at Mayo Clinic, I so hope that it'll be that much more of a values-driven organization because of the small part that Sister Tierney, you and I have gotten to play in the Values Council. And so I appreciate your question. But again, for all of our attendees, I really, really appreciate everybody being here today. And I hope this was of interest. I learned a lot from you, Sister Teresa, and I always do from you, Sister Tierney. And thanks, Melinda, for your leading us.
I've learned a lot too. Oh, I think we have to, oh, of course, go ahead.
One comment. Dr. Brown, you said, what would you do at 7 o'clock in the morning? I would try very hard to start by starting before 7 o'clock in the morning, which would be the self-care part. Because you cannot be present and you cannot really listen to others, and you can't be for them what they need if you do not take care of yourself. And caregivers, we're talking about this burnout issue. That is not in the nature of caregivers. And it's got to be something, you know, when you get on the airplane and they tell you to put on, you know, these are the instructions, and put on your mask first and then help somebody else. We do not think that way. But if you don't do it, no one's going to do it for you. And you can't stay in the game and push yourself unless you take care of yourself. So I just, you gotta do a little bit of that too.
Yeah, I love that comment. And what I would say is, I know we're finishing up, Melinda, when it comes to concepts and burnout, we didn't talk about this. It does relate to caring for oneself. It's part of professionalism, is watching out for oneself, but through your compassion value, watch out for your colleagues as well. I mean, I think that's something that we need to do. As Sister Teresa, you stated it so well, is caring for ourselves, but for all of us who are on today, part of our being a flourishing institution is having a mindset of watching out for our colleagues as well, just as we would for our dear patients that we have the opportunity to serve as well.
Thank you all. I have learned
a
lot from you. And I want to just turn this back over to Kimara and thank her for bringing us together.
Thank you.
Oh, thank you so much. And much thanks to our dynamic panel. We could stay on and talk for another hour about all of this, I think. I do want to remind you that if you would like to stay on just a little bit longer, we will have an opportunity for you to stay. and ask some additional questions. We also do plan to address the few questions that we were not able to get to during the panel. So please do feel free to stay if you'd like to engage with our panelists for just a few moments longer. At this point, I would like to just give us all a moment to reflect and share your perspectives on what you have learned and what you have gained and are exploring in your own mind and your own thoughts based on what our panelists shared with us. And so I'm wondering if you would put in the chat one thing that you would see yourself doing to promote a culture of flourishing within your own organization. Listen, listen, listen. Learn to be present, patient, listening, caring, express gratitude. Ooh, get the discussion going. Yeah. Model desired behavior, modeling, helping to promote others. Being open to feedback. Caring for others and my coworkers. State the values. Yes, name the value. I love that. Name positive values in others, call them out when we see it. Trying to be more intentional to see gifts and contributions and praise them for that. I love that. Name the value. Again, I'm going to say what I said at the beginning when we were talking about characteristics of flourishing organizations. Imagine if this was how we behaved within our organizations, the disruption that might be in some of our cultures and the opportunity to really begin to advance flourishing. And if nothing else, to get people to stop and say, my goodness, why does Bob always behave that way? What is that about Bob that makes him so different? And that opportunity to begin to change culture. Sometimes when we think about the systemic nature of things, it can be difficult to imagine how we can disrupt or make change as individuals. And I think our panel has really done a powerful job this afternoon outlining for us both that which can be done at the system level and needs to be done, and also as individuals with agency within those systems, what we can do to influence and disrupt the cultures that we are a part. So once again, I want to thank everyone for sharing your time today, for sharing your thoughts. On behalf of the Canon board and our whole program office, we're extremely grateful. And also want to make sure that I offer our thanks to our panelists, to our event partners, and the generosity. I want to make sure I call it the generosity of the Kern Family Foundation, without whom the work of the KNN would not be possible. Please consider continuing with us on this journey. If you would, on August 23rd, we will have our next Human Flourishing 2030 session, which is going to focus on the care environment. We're excited to welcome Stacy Chang of the Dell Med Design Institute for Health as our moderator, along with Dr. Danny Jacobs from Oregon Health and Science University and Linda Scott of the UW School of Nursing as panelists. As a reminder, if you do have questions for today's panelists, we're going to take about the next 10 minutes or so to hang on to do some Q&A. Otherwise, if you need to drop off, thank you again for being here, and we'll hope to see you again later this summer. Okay, and for those of you that have stuck around, if you've got any additional questions that you would like to ask our panelists, please do feel free to submit those questions via the chat to the Q&A, and we will make sure that we gather those as we go along. And I think what I wanted to do is just start, and this can really be for any of you. We had a question from Charles. He was wondering how the COVID pandemic has helped or hurt human flourishing, and maybe what your experiences have been with flourishing in light of the pandemic.
Sister Teresa, do you want to start? Then
well, I think you all in the hospital setting certainly had to deal with it more than we did. But I will say, I think at first, we saw a lot of public outpouring of appreciation for healthcare givers.
Yes.
healthcare providers with the, heroes work here, yada, yada. And I think that really helps solidify the spirit of, we can do this.
Mhm.
But as it went on, a year and a half, into 2 years, and now people, all they want to do is be done with the pandemic.
Mhm.
But our healthcare providers and healthcare workers are still dealing with it. And they're putting their lives on the line still every day, and they're being forgotten. And I think I think now they are feeling this sense of almost a betrayal, because what had started as real appreciation for them has been we don't even care anymore. Take off the masks. We're not going to protect one another anymore. I don't know. I feel like it has, we've reached a different place now that now people are feeling a lack of appreciation that we need to revive. I don't know what you all in the hospital setting feel.
No. And Sister Teresa, I think you've stated it well, whether it be in a hospital setting or outpatient setting. And, so much of what we've advised during the course of the pandemic has been driven by the science. And unfortunately, the science has become so contentious in so many different ways that can't help but be impactful in a negative way on somebody who's trying to do what they feel is the best thing on behalf of their patients, on behalf of the patient's family members, and on behalf of groups of people in the community. And so much of what we do is attempting to help people in the community as well. But it can't help but adversely impact on Flourishing. And as I mentioned earlier, of course, we're all so hopeful that we are coming out of this, and that we can now look forward to thinking about something other than the pandemic, and whether it be in practice, education, research, and in caring for ourselves and each other. And but the impact of the pandemic, when we look back, will be a notable one. Some aspects of the science have advanced in such remarkable ways as a result of the pandemic. And so much of what we do in working together as teams in the medical setting have really impacted us in a positive way, that we're working together in new and better ways. And that's where Flourishing can be supported. But I don't want to be naive in any way in suggesting that it's all a positive, because it's been a tough 2-year journey for all of us, and all of you who are still on today. I'm sure you found that as well.
Thank you. This question really goes to maybe a little bit more of the systems part or role in Flourishing. What structures and processes in an organization make it easier to do the right thing consistently as we think about organizational values?
Sister Tierney, do you want to comment? And I'd love to comment.
I think part of that is you have to really have embedded you have to be embedded in the formational values of the story, the history of your story, and have ways to consistently keep alive that dialogue that about who we are. If you notice in my background, that's a double helix. That's our visual for our Mayo Clinic values. And so we say to one another, colleagues, and to the public, this is who we are. These values describe who we are. This is what you can expect when you come to Mayo. And that's got to be kept alive in terms of being able, as I think Dr. Brown used the word, an accelerant to continue to take us into the future. It isn't just this came from our past, but alive today, and the accelerant to take us into the future. In the field of healthcare, every day there's something new. Your point, Dr. Brown, the good that's come out, some of the discoveries in that through the pandemic, in the science part, that to continue to flourish, but you've got to keep that structure of your values alive, that who you are. It sounds simple, but it's got to be a consistent everyday commitment to remembering who I am as a partner, as a person in Mayo Clinic, irregardless of what I do, what my work at Mayo Clinic is.
And Kimara, in follow-up to that, I think no matter how big your organization or small is your organization, one needs to step back and really consider a values assessment. That is, do we have values that in the value statements related to it, do they resonate with our mission? in our vision? And will they resonate with our colleagues? Number two, do those values relate to what we're trying to achieve? And I hate to use the word strategic plan because it's so corporate, but does it relate to what we want to achieve in the next 5 or 10 to 50 years as an organization? Number three, are the expectations regarding those values in action, are they clear? And do you set those expectations? Here at Mayo, we have something that's called a shared commitment document. Value by value, we share what is our Mayo Clinic commitment to our staff, our 73,000 staff, and what is our hoped commitment of our staff member to Mayo Clinic. And so it goes through our 8 core values and our primary values. So the expectations are clear, but also our staff have the opportunity to then talk further about what do these values look like in action. And so then you make sure the expectations are clear. You make sure that the leaders are talking the talk and walking the walk, as Sister Teresa had mentioned earlier, but then have some strategies in place. Start with baby steps and then grow from there to put the values at the forefront early and often throughout the time that a staff member is a member of your organization. And I can't emphasize that enough. You can start with baby steps and then expand it from there. And the term evangelize our organization with our values. Somebody in the chat, when you had asked the question earlier, they use that term, and I think it's beautifully stated, and it just means early and often, make sure the values are relevant, that they come alive, and that you listen to your colleagues when they're talking about the values in action. And if you fail, which we do all the time, hold ourselves accountable and move forward in a different way.
You know, there are a couple of things that, as I think about, I mean, they asked the question around structures, what structures you can put in place so people do the right thing. A couple of things several things that come to my mind when I think about that. People need the tools to do their job. And that can be equipment, that can be supplies. I remember one time we were going through some real cost-cutting stuff and people weren't able to order pens. Really, you can't give somebody a pen to be able to chart or to do whatever they have to do. So giving people the tools they need and giving them the training to do it right or do it well. I think there needs to be in place a process, a non-punitive process for people to bring forward issues and concerns. Because they've got to be able to tell you what's not working well. And if they think they're going to be punished for that, then they're not going to do it. There needs to be a really sound, equitable way to reward and recognize the behaviors and the practices that you want to promote. And then you have to have an evaluation process in place that you carry out consistently. Those are structural things that leadership has to put in place. And if they're in place, then people can do the right thing.
And Sister Teresa, in follow-up to what you just said, if you can connect the values to that evaluation process, boy, you'll be that much better off, because then
you tie your value to the fact that you're giving them the supplies and the tools that they need. And all of that is value-based. And the more you can make that connection, the more they'll understand the values in action.
Here at Mayo, we've even gone so far as the annual appraisal goes through value by value. And if a colleague is struggling, we're able to share with them how they're struggling in the values that have been part of the discussion dating back to the time they were recruited to join us and in onboarding. So the point is, that's another way of making the values very relevant, is putting it on the annual appraisal. And that's another specific that can really work out quite well for an organization.
A couple of departments have taken each value, like respect, and identified for us in this department, IT or a medical one or general services, what are the specific behaviors that show the value. So they've created their little manual within the larger construct, very particular. Just doing that, the process of doing that in the department was very, very helpful and good. And then they continue to use that in their own evaluation of themselves, as well as in the formal evaluation appraisal.
Somebody put in the comment section that it's like a high reliability organization. It is the same principles for implementing highly reliable values as it is highly reliable clinical quality. You have to use the same principles of putting the right things in place. And thanks, Stephanie, for putting that in there.
Thank you. Well, we've got one final question that I'm going to put out. And just to quickly say, Bob, people are wondering if it's possible, like, is the Mayo survey instrument that you referenced, is that available or accessible for other people to see?
You know, that's a great question. It's an internal all staff survey, so
Okay.
I don't know how widely available that is, admittedly.
Well, we will follow up maybe offline about that and with the individuals that talk. So maybe one final thought from Kristen. She asked, what are your thoughts on values and ethics being protective against burnout and attrition? And Melinda, please do feel free to answer as well.
I'll have my colleagues comment and I'd be delighted to.
Would you mind just rephrasing it? Say again, because the way it's phrased was great.
Yeah, I would be happy to. What are your thoughts on values and ethics being protective against burnout and attrition?
I think that there's certainly the personal aspect of when I am feeling like my values are being, I can live out my values, then I can thrive. If I don't feel like I'm living out of my value system, my personal values, then I'm going to struggle. And that's where I'm going to feel burnout. I'm not going to feel fulfilled. And so the more I can align my personal values with an organization's values, the more, that's when I'm going to thrive there. And it's going to be how I'm going to find my energy and not burn out. It's when that little fire inside of me, that's the burnout, right? When that little fire is not fed, is not nurtured. And I don't think you can live very long not fulfilling your own values.
Yeah. You know, Sister Teresa, I really appreciate that comment, because we're oftentimes challenged to say, look, you have organizational values at Mayo Clinic. We have our primary value, needs of the patient come first, and we have 8 core values that support it. But don't I come to Mayo Clinic with my own personal values from my life experiences and my family and friends? And absolutely is the answer. And we just want to make sure that they reconcile well. And when they do, that's a recipe for flourishing in the workplace. And if they see that for whatever reason, that here at Mayo Clinic, we're going in a path that we're not living up to those organizational values that we espouse, then there's going to be a disconnect and they're not going to flourish. Their well-being is going to suffer, and burnout is going to increase. But if they can feel, yes, I am working at an organization where the values are being put forward to the absolute extent possible, it does mitigate burnout. There's no question that can help tremendously.
Melinda, did you want to comment?
I was going to say that I think that is all true, and there's no, it's certainly true that having your values aligned with and reinforced by your organization is I would imagine it's protective against burnout. And I can't speak from personal experience on this. I can only speak from talking with colleagues and not just at my own institution. But I think that we can hold ourselves to such high standards that we have people worried about themselves when they are faced with circumstances that cause them to become angry or fear that they're losing their compassion. And I think there were times during this pandemic when that happened, and we have to be able to heal each other through those times. And so it pains me to bring this up and to remember some of the stories I've heard, but really people have been pushed to that point.
I think one of the things that's difficult, we did this exercise one time within our community where we did small table exercise of listing our values and then prioritizing our values. And it wasn't that people had different values. It was that they prioritized them
Oh, yeah.
differently.
Mhm.
And an individual is going, potentially, will prioritize their values different than an organization will. I hope they will. The organization, Bob's organization, has got to put the patient first. But I got to put my family first.
Yeah.
And the organization has to figure out how to live within that tension and respect the value prioritization of individuals.
Yeah.
Because it's the individuals that help the organization carry out its mission. And when we forget that the individual's values may be prioritized differently, and that they're not just being selfish because they need to go home. But it is a tension. It's a tension we have to live with. And I believe it's the duty of the organization to take the step towards the individual and not the other way around. I asked my colleagues, they may feel differently about that.
Oh, no, Sister Teresa, I think you're spot on. And one of the challenges of the pandemic, and all of us who are reflected today likely have a primary value that focuses on the patient in some way, shape, or form. And by having that as a primary value here at Mayo, needs the patient come first. The risk is always, eventually, don't I become so fatigued from trying to live up to that primary value that no matter how energetic one is, no matter how values aligned one is, that burnout is going to set in.
Mhm.
And this is, I think this is part of the two-way street of professionalism, if you will. Is professionalism is defined here at Mayo as putting our values into action. And that is all about focusing on our patients and on our colleagues. But there's also a part of professionalism that is focusing on ourselves and on our families and other things that we love in life as well, to help to that is what ultimately is going to mitigate burnout. It's trying to find some balance. And in the pandemic, was it weighed more heavily toward one's professional activities just because these dear patients were struggling so mightily? Absolutely. And so now that we're coming out of that, I think everybody is looking to re-energize, to refocus themselves, both personally and professionally too, asking them questions. What is our mission? What are our values here? And how are we going to move forward in a positive way as we get out of the pandemic and be able to move forward in a positive world?
Well, thank you so much. This has been so energizing, and I'm so grateful for all the extra time that you've given us. I do just want to mention, we did get one last comment in the chat, really from a colleague of ours that's joining us today from Japan, and talking about, sort of the differences between cultures and virtues and values based on, the cultural background that you may have. And certainly at our health systems and within our health ecosystem, right? These are global issues. And so, she was just commenting on, sort of the ethnography and the ethnological value and piece. And that might be something for us to explore more deeply in a future session, as she mentions as well. But I do think it's worth mentioning as we talk about value and virtue. And Sister Teresa, you so beautifully talked about the individuals, the values of the individuals, and recognizing that we do work within global cultures ourselves, and different values and virtues that come up through that.
And I think, when Sister Tierney described the work that they're doing around diversity, the more we are able to appreciate diversity, because that ethnic background and the family background, that's all a part of the diversity that we have to work within and live within. And so the more we can appreciate that and become aware of the biases we have, when those nurses were quitting because they had to take care of elderly parents, that's respecting where they have to put their priority and understanding that they're in a different situation than I am. I had the luxury of not having to do that. They didn't have that. But if we don't appreciate it, we can become resentful of it. And resentment is that first thing that starts to put out. Somebody described it as the pilot light. Resentment will douse that pilot light, that little fire in us, quicker than anything else.
Mhm.
And so learning to appreciate where people are coming from, I think helps stoke the fire instead of douse it.
Mhm. And again, it's not just tolerating, it's
No.
looking at and appreciating, valuing those differences.
Exactly.
And one of the phrases, Dr. Brown, this was Nan Sawyer, that I've heard so often, assume benign intent. You know, assume benign intent. People are acting out of goodness, out of whatever, but assume benign. That's been a gift to me. That has come to me in my almost 10 years of help. Assume benign. We so quickly judge or.
It's so nice to
conversation.
put that way. I usually say, nobody got up this morning just to tick me off.
Yeah, right. Yeah, there are many ways to, I think, right.
Well, again, Melinda, Sister Tierney, Bob, Sister Teresa, thank you so much. Thanks to everyone who hung out with us for nearly an extra 30
Yes.
minutes. So grateful to all of you. And my hope and my wish for all of you is that you will go forth and be flourishers within your organizations, and that someday you'll be able to sit on a panel and talk about all of the things that you did to advance flourishing in your organization. So again, please consider joining us in August. And so until we're together again, thank you all. Be well.
Thank you for inviting.
Thank you,
Take
everybody.
care. Be good to yourselves.
All the best to you. Bye, everybody.
Bye.
Thank you.